We went in at 2 p.m. for what was expected to be a routine scheduled C-section. I was the one that noticed the blood in my wife's catheter, brought it to the attention of the staff at Cedars-Sinai shortly after 4. It wasn't until after midnight that they finally took Kira back to surgery. When they opened Kira up, there were 3.5 liters of blood in her abdomen, and her heart stopped immediately. There was nothing they could do to bring her back. And I have to ask the question, would that have happened if I was not African American?
The U.S. has the worst rate of maternal deaths in the developed world. In the U.S., the risk of pregnancy-related deaths for Black women is 3 to 4 times higher than those of white women. So what is going on?
When this first happened to us, I was like a lot of Americans. I thought that this didn't happen to women in the United States. I thought it was something that happened in the Dark Ages.
It highlights a chronic and pervasive problem of not trusting Black women, of not listening to Black women, and valuing Black life and Black mothers and Black births. I always akin the healthcare system to law enforcement. We racially profile.
People ask me all the time, how does that show up in health services provision? I always say, if you don't listen to people and don't believe them, you might be in a position not to recognize the signs and symptoms of deterioration.
And there's also a bias, especially with, I think, Black women or women of color in general, that we are able to tolerate pain more.
I also think there's a narrative that we come to pregnancy older and sicker and fatter. And that's just not true.
And this is the thing that haunts me now. I think maybe, what if I had raised my voice? What if I had slammed on the counter? But the entire time I was thinking, I've got to stay calm. Because if I raise my voice, then as an African-American male, I become seen as a threat.
The Fox medical drama, The Resident, actually did an episode based on Charles's story.
Chris Basunian and Tiana Langham, who I co-wrote this episode with, brought me the story of Charles and Kira. And we were instantly moved beyond words.
I'm so grateful to Amy Holden Jones and the entire team at Fox for just really pouring their talents into making this something that would do not only cure justice, but the thousands of mothers that we've lost. My hope and my prayer is that by sharing her story, it will have an impact so that when my sons are ready to have children, we'll talk about this maternal mortality crisis in the historical context.
60% of these deaths are considered to be preventable. So there's actually some hope that there's something we can do about it. Half the births in the United States are covered by public insurance, or what we call Medicaid. Half the births. So as taxpayers and individuals who are invested in maternal health care, we should expect to see better outcomes.
Every person who chooses to continue their pregnancy and to birth deserves to be treated with the utmost respect and dignity, regardless of their background, their individual characteristics, their community.
We just need political will and efforts of many, many individuals working on these issues.
The reality is that people in this country who care about mothers and babies are the largest constituency there is. Because there are 2 types of people in our country. Either you are a mama or you got one, right?
Right.
There is no path to the White House in 2020 or beyond without a clear, comprehensive plan for what you are going to do to address the maternal mortality crisis.
Say it, Charles, say it.
We need you all to raise your voices and demand that.
When I think about what Hollywood can do, this is the first step, is opening up the discourse, talking about these things, bringing experts in to shine new light on it and to give the facts.
Hollywood tells stories and everybody sees them, believes them, has an emotional connection.
There's a lot of data about how that's been able to move a lot of opinions. You're able to dramatize and elevate these already very dramatic stories and bring them to different people.
What we try to do on The Resident is to tell stories about human beings we care about and address issues within the medical environment. Hollywood Health and Society has been a great resource for us. They help link us to doctors. The doctors help advise us in any particular specialty that we're working on in a story. It's actually a spectacular resource that is freely available to all writers.
I'm so grateful for Hollywood Health and Society for addressing this topic. It's so critical, it's so instrumental. This is a powerful opportunity and we have to seize it, not only for this issue, for other issues that make our world a better place.